To hear the words, "you have cancer," yet over 500 Canadians will be diagnosed with cancer each and every day. Many more, though, are surviving the disease. Health specialist Leah Sarich now with how mindfulness is helping patients recover. And this is so interesting to me that the sort of spiritual angle is starting to marry with the science.
Exactly. We've been waiting for this. This is new sort of in medicine, but it's really making a difference for these patients. So the Tom Baker Cancer Center here in Calgary runs an 8-week program, and it's called Mindfulness-Based Cancer Recovery. They've actually been doing this for a few years now, and they've been doing so for years, but now research shows that this program is actually more effective than even group therapy for helping cancer patients recover. So the woman behind this program and this latest research is Linda Carlson. She's a clinical psychologist. She's published all over the world. She's a really big deal. She runs the mindfulness program and did this research, and she explains exactly what she means by mindfulness.
Mindfulness is really about learning to be awake and aware and present in the moment as your life is unfolding, with an attitude that's accepting and non-judging. So this is very simple, but it's not easy. So if you think about where your mind often is, it might be in the past, saying, "Oh, why me?" or "if only this," or "if only that," and then you have regret and depression and anger. Or it's racing off to the future. You're saying, "Oh no, what if this happens? What if that happens? How am I going to get it all done?" And you get worry and anxiety. So if you can just be in the present, all that falls away, and things are actually a lot easier and more vivid, and the experience tends to be a lot more pleasant.
Isn't that wonderful? So this is Linda. She's doing a bit of meditation right now with some cancer survivors from her program. So they do some sitting meditation practice that you're seeing here. They also do a little bit of gentle yoga. They're basically retraining how the patient thinks, and then in doing so, they're actually rewiring the way the brain works. So for cancer patients, it's so helpful because they suffer from feelings of loss of control, uncertainty about the future, symptoms like pain, sleep disturbance, even mental health issues, of course, like anxiety and depression. So it helps for all of these things, as we said, better than even group therapy. And Linda said, you know, group is really cathartic, so it's still really, really helpful, but it's not as helpful as this mindfulness training. So researchers are really measuring these physiological effects. So they're looking at saliva and blood samples. They're measuring the stress hormone levels. They're even looking at immune function. So they're measuring cell aging and things like that. And the mindfulness improved all of those factors. All of them. So I actually spoke with a breast cancer survivor who just finished her training with Linda, and she finished her breast cancer treatments in November. Here's what she has to say about the mindfulness training.
I would wake a lot in the night with pain from neuropathy from chemotherapy. And because of this program, when I wake in the night, I don't start thinking and planning lists anymore. I focus on the breathing techniques we were taught and doing body scans and relaxing, and I find I get back to sleep so rapidly now. The difference this course has made is it offers me the ability to have 2 to 3 hours more sleep a night than I was getting. And I find my mind is clearer, I can function better, I have more energy.
Isn't that amazing? More sleep, more energy for these cancer survivors.
Okay, so you have to think at this point, the natural progression is this can apply to all kinds of aspects of life and medicine.
Absolutely, absolutely. So even at the Tom Baker, they're now offering it to all kinds of people with a cancer diagnosis and their caregivers as well. So that's great.
That's huge.
But elsewhere in the world, they certainly are applying this mindfulness to chronic diseases. So things like even high blood pressure, diabetes, organ transplant patients, even those suffering from other mental illnesses as well. So it is going broad for sure. And Linda herself wants to now look at this in terms of other kinds of techniques like acupuncture, Reiki, things like that, just expand the whole concept.
Wow, a whole new world,
Whole new world in medicine, that's right.
And are they looking at this research beyond where we are now?
They are, yeah. So they've figured out that this works for mindfulness training in cancer patients, and they're going to expand it onwards now to other chronic diseases.
Okay, information on your
All
blog.
on my blog.
breakfasttelevision.ca. Health specialist Leah Sarich, thank you very much
You're very
for
welcome.
that.